Good afternoon, everyone. We're excited that we got you after the ice cream and the espresso. So please think of questions you want to ask us at the end. Before we begin, could I just see a show of hands, please, of folks who work broadly in healthcare and life sciences? Always curious. That's wonderful. I won't count, but it's quite a few there. And it's one of the reasons I'm really excited to be a part of this discussion, because over the years I've seen more and more MIT alums move into the industry of healthcare and life sciences. And it's a really exciting time given the degree of disruption and transformation that's happening and the really big role that AI is playing in that. So let me start by introducing our amazing panelists. On my far left, I have Mathai Mamin, who is the global head of R&D at Janssen Pharmaceutical Companies of Johnson & Johnson. Prior to Janssen, Mathai was SVP of Oncology, Immunology, and Cardiovascular and Metabolic Disease at Merck Research Labs, and was previously co-founder and head of R&D at Theravance and Innoviva. Mathai received his MD from the HST program, which is a joint program between Harvard Medical School and MIT, and his PhD in chemistry from Harvard University. To the right of Mathai, we have Anmol Madan, who is the chief data scientist at Livongo, which is the leader in empowering people living with chronic conditions. Previously, Anmol was the co-founder and CEO of Ginger.io for 7 years. Ginger is an AI-driven behavioral health company. Anmol received his PhD in machine learning applied to human behavior from the MIT Media Lab. Immediately to my left, we have Ted Goldstein, who is the chief AI officer at Anthem, which is the second largest health insurer in the US with over 40 million members. Prior to Anthem, Ted was assistant professor and a cancer scientist at UCSF, director of research at Guttman Initiatives, and he has also held technical leadership roles at Apple and Sun Microsystems. Ted holds his master's and PhD in bioinformatics from UCSC. So we're really excited to have all three of you here with us today, and I think it's amazing that you bring such diverse backgrounds and unique perspectives. Now, before we dive in, I think most of us here are really aware of the overarching problem that the US is seeing in our healthcare system, right? Our annual healthcare spend has reached 3.6 trillion, which is 17% of our GDP, and it continues to grow at 4 to 5% each year. When we bring that to our homes, I was at a barbecue a couple of weeks ago in Palo Alto where a family was sharing with me that for their family of 4, where they now buy insurance on the exchange, they spend $3,500 a month for health insurance. It's more than their mortgage. So those numbers are really affecting our pocketbooks, with more than half the country also on high deductible health plans. So these are real issues, and there are many underlying problems that lead to that overarching issue, and AI is going to play a big part in that. So, I have the master clicker here. I did want to share one statistic, which shows just how much healthcare is embracing AI. If we look at this chart from CB Insights, over the past 5 years, from the start of 2013 to the middle of 2018, private investment into healthcare AI startups was $4.3 billion, spanning about 576 deals. That level of investment and activity in AI surpasses that of any other industry. And I know we heard about some amazing AI feats in the talks earlier today. So it's really wonderful that healthcare has embraced AI to that degree. And the question really that comes from this is, okay, so where are the benefits and when will we start seeing the benefits? Well, based on where the investments are going, these are the 3 areas that we can start to see some of those benefits initially: digitization, consumer engagement, and diagnostics. So now let's turn to our expert panelists to get some real-world insights on how AI is really improving healthcare. And I'll start with the big picture question to each of our panelists. In your respective fields, what do you feel is the potential for AI to really make a difference in healthcare?